If you are worried you have Lyme disease, or just like the outdoors, and want the peace of mind of knowing whether you have Lyme disease or not, there is a new Lyme screening test based on decades of research by Dr. Richard Marconi, a professor at VCU Medical Center. For more information, visit glymedx.com, that's glymedx.com, or email at info@glymedx.com.
Infectious diseases, research, medicine, health. Welcome to Outbreak News Interviews. And now, broadcasting from the Outbreak News Skylar Studios in beautiful West Central Florida, here is your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Hey everybody, this is Robert, and welcome to the latest episode of Outbreak News Interviews. Now this week is World Antibiotic Awareness Week. It goes from November 13th through the 19th. It's an annual observance to raise awareness of the threat of antibiotic resistance and the importance of appropriate antibiotic prescribing and use. Well, joining me now to talk antibiotics is Rodney Rohde, PhD. Dr. Rohde is the chair and professor of medical laboratory science at Texas State University. Dr. Rohde, welcome to the show.
Thank you, Robert. It's always great to be on.
All right. Well, let's go ahead and start with a primer on antibiotics. What are they, and can you give a little bit of history about them?
Yes, sir. It's a dangerous question, Robert, because when my students ask me to talk microbiology history, they know they're in for a long story usually. Love talking about all sorts of things around microbiology. But, antibiotics have actually been around for really centuries, if not longer. It goes all the way back to the ancient Egyptians and that time frame where they were using things like moldy bread to actually treat infected wounds. And, we didn't even know what these agents were. We just knew that they killed in many instances. And so they were looking for almost any type of substance, if you will, to try to stop that process. It was around probably the 19th century that scientists began to kind of observe that some things had antibacterial chemicals. One of the earliest people, a gentleman named Paul Ehrlich, a German physician, noticed that some different types of dyes actually did things to bacterial cells, and then he actually discovered a chemical called arphenamine that was effective against syphilis. And again, he really didn't know the mechanism of action, but because of that, he kind of referred to himself as the father of chemotherapy, and that kind of was off and running. And then a person that most of us know, even maybe some of the general public have heard about, Alexander Fleming, because he was the one that kind of accidentally discovered penicillin by really just noticing that a fungus called Penicillium notatum on one of his culture plates for a typical bacteria you find on skin called Staphylococcus was killing it. And so, long story short, he kind of started working with that particular fungus and going through different types of experimenting and even linking up with some biochemists named Florian Chain later. Mm-hmm. He won the Nobel Prize in 1945 for that kind of really the first mass-produced antibiotic. And as you know, when these things first came out, when you're thinking about that time frame from the 1920s into the World War II era, they truly were wonder drugs. They helped us probably win World War II because of their effectiveness in treating wounds and things like that. But even that far back, and you can find this, I believe it was in the New York Times, Fleming actually warned us about antibiotic resistance because he started noticing it even in those times, and he actually wrote a op-ed about we really shouldn't be using these without some high restrictions on it. I think his recommendation at the time was to kind of a patient should really be under the care of a physician, even within a hospital, to get an antibiotic so that you wouldn't have it happening in like physicians' offices and other routes. But of course, by then the horse was out of the barn, and it was too important because it was saving so many lives. So it kind of just stopped at that point.
Okay, and as you mentioned, it was a wonder drug, especially during the World War II, and countless lives have been saved thanks to antibiotics. However, like you also mentioned, there's such a thing as antimicrobial resistance. Dr. Rohde, what is antibiotic or antimicrobial resistance, and how does this happen?
Antibiotic resistance is really just kind of the way to think about this is really just the ability of a bacterium, when you're talking about antibiotics, to resist the effects or the wanted outcomes of that drug. So it happens in a number of ways. Sometimes bacteria become resistant through a process where they kind of chemically neutralize an antibiotic. They basically change it in a way that makes it harmless. So for instance, they might secrete a new enzyme like penicillinase that will break down a particular antibiotic and basically takes away its mechanism of action. Other times bacteria will learn how to kind of pump it out of their cells. So it might get into the bacterial cell, but before it can really do any harm, they've found a way to kind of pump it out. And some bacteria might even learn how to change their own outer surface or something about their own cells so that the antibiotic has no way to enter or even to attach to some component that's going to kill it. So they're very crafty. I know we've talked about this before on your show, and I talk about it all the time with respect to, microbes just don't read books. They don't care who you are. They don't care what antibiotic is thrown at them. They are some of the world's greatest kind of con artists with respect to how they can adapt, and very, very wily opposition for us, with respect to doing this. And even if you use antibiotics, in a sense that you're trying to use them correctly, they just have so many ways to resist that even if it only takes one single bacteria that you do not kill with an antibiotic that can then become like the primary reproducer and really kind of replace those sensitive bacteria. So in a sense, you can drive this problem by taking antibiotics incorrectly or overtaking them to an extent that it's not going to work. So I know we'll talk about that a little bit later, but there's all sorts of mechanisms that bacteria kind of mess with that process.
Now, obviously this is a big problem. Otherwise, we wouldn't have World Antibiotic Awareness Week. But Dr. Rohde, how big of a problem is antibiotic resistance globally and here in the States?
Yeah, this is a big one. So if you look at the latest global and kind of national numbers around this, just in the European area and the United States, there's about 50,000 deaths per year. If you look globally, it's estimated about 700,000 deaths are occurring each year from this globally, from antibiotic resistance. And the CDC estimates there's actually about 2 million infections from these agents in the United States, with about 23,000 deaths in our own country. So there is just list after list about the devastation of this globally. I mean, there's a comment in one of the sources I was reading earlier about in India, in 1 year, 58,000 babies died from resistant bacteria, usually passed on from their mothers. Right. So, of course, when you get into some of these countries that might have different types of healthcare systems or different types of hygiene and different types of the ability to kind of handle these things within hospitals and so forth, you might get different stats. But globally, it's a huge problem.
Now, what are some of the biggest concerns today, the different types of resistant organisms?
Well, I mean, again, there are dozens and dozens of these, but some of the primary ones that I'm always keeping my eye on, and many of my colleagues are, one of the most dangerous ones right now is called Clostridium difficile. So C. difficile is a primary player in respects of resistance, but also in that it can be a spore producer and can do real damage. There is the one that I work with in my research area, which is methicillin-resistant Staphylococcus aureus. And as we've talked about before on your show, that is primarily an organism that for decades and decades and decades was very treatable with just simple beta-lactam antibiotics like penicillin. But back in the 40s, basically, they started becoming resistant, and they've kind of moved on into what's called methicillin resistance, which is a whole group of antibiotic drugs. And in many cases, we're seeing this more and more. There's multiple drug-resistant tuberculosis. There's one in the past year that we couldn't even treat. It's pronounced carbapenem-resistant E. coli, and CRE is basically one that, or Bacteriaceae actually.
Right.
This is an organism that in Nevada in the past year, I believe, and I'm gonna guess here, it was like close to a dozen or more antibiotics were tried to prevent this person from succumbing to the illness, but they just couldn't get it treated. So it is a huge problem. Most global estimates, I know we talked about numbers earlier, but the World Health Organization is really looking at predictive models that show this problem by 2050 will probably have a global impact of about $100 trillion and pushing 10 million deaths. And when you break that down into kind of everyday terms, that means we're looking at one resistant infection about every 3 seconds when we get to that time frame, and it's going to surpass cancer as the number one killer, which kind of is mind-boggling to me when you think about how big cancer is. So if we truly don't do anything about curbing this problem, even slowing it down, we're going to be looking at an entirely different landscape with respect to infectious disease.
Yeah, and there's another one that's really becoming concerning to many is the resistance to gonorrhea that we're seeing now.
Oh, absolutely. Yeah, for sure. I mean, me and we could certainly talk back and forth about this. Mm-hmm. The general public may not know all the acronyms, but I talk about these acronyms a lot because it gets maddening. I mean, VRE and MRSA and CRE, and I mean, there's just one after the other. So I think it does get overwhelming for people. So, I think talking about antibiotic resistance as kind of a term is really helpful because sometimes it's hard to drill down into all the different types of infections that you can have, but certainly it's a huge problem.
Right. Now, you kind of alluded to this already, but Dr. Rohde, can you talk about the issue of overprescribing and antibiotic stewardship?
Sure. So, I mean, really, if you get out and you kind of think about this problem with respect to what's going on to what we've already talked about and how bacteria are so ingenious in how they can become resistant, what happens is that when you don't follow the rules, basically, you are giving bacteria a very easy route to become more of a problem. So whenever a person takes antibiotics and you're killing off those sensitive bacteria, you have to be aware of that some in that grouping, some in that population are going to be more resistant just genetically, and they're going to be left to grow and kind of multiply. And so if you don't kill off all of them, then that's obviously going to increase the number of those drug-resistant bacteria. So all of those things around taking antibiotics for the correct amount of time, taking our antibiotics when we're supposed to, not borrowing antibiotics, not what I talk about, which drives me crazy, is when kind of thinking about the self-diagnosis. I think many of us are guilty of this. I know I've done it myself in my lifetime, especially way back when, you think you have something going on and it's probably an allergy or virus, and you show up and either, you're begging your physician or your caregiver for an antibiotic, and you can really put a lot of pressure on that healthcare provider if they're in a hurry and they've got other things going on, and they may just prescribe you something based on that interaction. So really that piece gets into my world, which we've often talked about, and into your world, which is this kind of role that we play for educating the public and healthcare personnel and professionals about, if at all possible, to not prescribe antibiotics unless you can base that on a confirmatory lab test in the medical laboratory. And we know that can't be done every single time. And for instance, in areas of emergencies where you might have sepsis or something like that, and you just have to guess and go. But in general, we know antibiotics are not effective against viral infections like colds and flus and sore throats and bronchitis and ear infections and sinus infections. I mean, these types of infections, and it's coming right now, right? I mean, the winter season. Right. These types of influenza-like illness and allergies and upper respiratory types of illnesses are just notorious for being overprescribed for antibiotics, and so that can really promote and spread that resistance problem. So for me, it's always going to come back to education at all levels in the general public, but also in the healthcare area, to try to get people to understand that it's tough sometimes to kind of do it the hard way, but you may need to do it the hard way. You may need to say, no, let's watch this for 2 or 3 days and certainly come back if you're feeling horrible or your fever doesn't break or something like that. But it's a two-way street. It's both our side as a patient and it's also on the side of the healthcare giver.
Right. Now, there's a term that's floating around these days with the way the situation is becoming, and it's called the post-antibiotic era. Dr. Rohde, what is a post-antibiotic era, and do you believe we're actually headed there?
This is a great question. Personally, so just speaking personally, I actually believe we're not just at the doorstep of this era. I think we're actually stepping through it currently. I mean, the post-antibiotic era is defined basically as one in which antibiotics are going to be no longer effective. So I don't believe we're, at the no return point, but we definitely better start acting now globally to try to curb and slow that growing resistance issue. I mean, we're seeing deaths now from these microbial agents that are not responding to certain types of antibiotics. We mentioned the CRE case in Nevada. I'm sure there's cases we don't even record for a number of reasons. I personally work with many people in the general public that are dealing with ongoing and kind of devastating infections from things like MRSA in my work. In my rounds of what I've been doing in the last year or two as a more avid speaker on this topic, I met someone, her name's Mary Maillard.
Oh, yes.
And we might talk about trying to get her on your show. She's a patient advocate, and she lives with a Pseudomonas aeruginosa biofilm related infection from a HAI, healthcare associated infection, and she picked that up during just a heart surgical procedure, and she's on some unbelievable
Cipro
amount of Cipro that she takes daily, and it's just so overwhelming and sad to hear her story. I met her at a Healthcare Services Summit conference where we were talking about the environmental cleaning and disinfection part of this problem, and I just see this more and more, Robert. I mean, it's really disheartening when you start meeting people, especially. So I know you've done some of this. It's why I love coming on your show too. Is I think storytelling with these types of kind of patient advocates where it's real, it always grounds me. It brings me back to why I'm doing what I do. Just trying to move forward in some way, even in small steps, can be helpful. But I'm really concerned. I mean, I've got a father who deals with an MRSA issue with his one of his feet. I've got friends of friends or family friends that I hear this from. Of course, they know what I do for a living, so I sometimes get those types of calls, but it seems to be growing kind of anecdotally, but it feels like it is too statistically.
Yeah. Speaking of Mary, I have had her on to tell her story.
Oh, great.
A couple months ago, and I've never heard of anything quite like that before. So
it's unbelievable, isn't it?
So I encourage listeners to check that out. Mary Maillard and her story about her sepsis and Pseudomonas infection. Dr. Rohde, so what's being done at the global and the national level to stop this post-antibiotic era from happening?
So there's a lot going on. I mean, I think I'm excited because I think both in the United States and globally there has been a refocused effort on this problem. I think we paid it a lot of kind of slow lip service for the last couple of decades, but it's really kind of heated up. And I mean, we all have a role to play, but certainly in our country, CDC is kind of the lead agency, and they're working with a variety of human and animal health experts to kind of fight this antibiotic resistance problem. One of the things they've done recently is they've launched something called the National Strategy to Combat Antibiotic Resistance. And their partners, like I mentioned, are across all kinds of things. So they have healthcare providers, administrators, veterinarians, even farmers. I think they work with pharmaceutical companies and ag and environmental specialists and, all the players. And so that's kind of going on where they've laid out some objectives, and we can talk about those if we want to. In 2015, WHO launched the first World Antibiotic Awareness Week, which is why we're on talking this week about this, and it's kind of aimed at the awareness factor through public communication. And what's one of the tools that I think is very important that's come out of this effort is that CDC, when they collaborated with different ministries of health and they're looking across this landscape, they've really started working for a product. So they're looking at providing technical assistance with their partners to build antibiotic resistant laboratory capacity, which is really important, surveillance systems, kind of global surveillance system, infection control for other countries and our own to kind of detect and track things. And then they're gathering that as a way to kind of target intervention strategies at kind of from the local level to the globe or to the national and to the global level, and really to kind of promote antibiotic stewardship programs. If you haven't heard of this system, it's called GLASS, and GLASS stands for Global Antimicrobial Resistance Surveillance System, and it's a standardized system and a standardized approach really to the collection, the analysis, and then the sharing of that data on a global level, so that you're trying to get everybody plugged in to a similar system, and we don't have a bunch of different toys that are kind of looking at, each state or each whatever. All those are still important, but trying to track it from a more global effort. And this was in May of 2015, the World Health Assembly endorsed this kind of global action plan to tackle this problem. So they kind of set out 5 strategies. One was to improve the awareness and understanding of this resistance issue. Another one was to strengthen the knowledge through surveillance and research, certainly to reduce the incidence of infection, optimize the use of antimicrobial agents, and then lastly to develop kind of an economic platform for sustainable investment that kind of looks at all the diagnostics, the medicines, all those developments around vaccines and things like that. Mm-hmm. So I know that's a lot to kind of throw out there, but I'm excited personally because we needed, in my opinion, a global international look at this instead of just trying to tackle it from different national or state or local efforts, because that can actually cause some problems when you're thinking about some of these strategies. So hopefully that will start showing some results in the short term.
Let's hope so. Now, one of the contributors to some of this antibiotic resistance, of course, is the agriculture industry. And Dr. Rohde, what is the agriculture sector doing to assist in getting this under control?
This is certainly a concern, as most people have heard and read about. You see this all over the kind of the popular news with respect to different companies that are stopping antibiotic use in animal feeds, or it's almost like a competition now if you kind of watch the landscape. But I looked some of this up, Robert, because I was kind of interested myself in some of the numbers, but it's estimated that about really over 1/2 the antibiotics in the United States are used in food animal production, and that's a huge number.
Yeah.
So the overuse of these things in food animal production is really underappreciated. I think everybody kind of understands it. And then in both human and veterinary medicine, that really has implications each time we're exposing bacteria to these antimicrobials, you're setting up again this resistance issue. So it's my understanding that the U.S. Food and Drug Administration has been moving forward with kind of a new strategy to encourage kind of more appropriate and prudent use of antibiotics in different types of food-animal situations. And they're really trying to identify certain antibiotics that will require veterinary oversight. That's kind of in collaboration with the FDA to look at the drug companies that are dealing with antibiotic products around feed efficiency and growth promotion claims. So almost trying to shift the culture of, what you might hear at the fork level of the farm, from farm to fork, and how that kind of is because it's a big deal, right? I mean, these are major corporate types of situations that reaches all the way down to the local farmers that are making money through this process. So you certainly don't want to ruin an industry, but I think it is important, and so that's going on. They've started doing some work with actual collaborative efforts with the FDA, the U.S. Department of Agriculture, and really looking at how they can keep certain over-the-counter drugs, especially under closer kind of veterinary watch, and that would help, at least on the early stages, to kind of start preventing that from happening. And then I think I'm not as familiar with kind of the larger picture around fast food and different things like that are trying to remarket and rebrand themselves as being, if not antibiotic free, at least major reductions in how they use for their products that they sell to us.
Well, clearly something has to be done, and
absolutely, it's probably the most. I shouldn't say. I would guess that it's probably one of the most under supervised types of things when you think about. I mean, I grew up on a farm. I can remember my father in a small farm, but I can remember my dad, buying all sorts of different things to administer without much oversight at all. I mean, you could go into a feed store in Texas and buy different types of antibiotics and different types of things without much oversight at all. So certainly, if you think about the large scale of what that might be, it's kind of scary.
Yeah. Now, you kind of discussed a little bit about what individuals can do when we were talking about overprescribing. But for the listeners out there, the Joe six-pack and everybody else, Joanne six-pack, what can individuals do to prevent and control the spread of antibiotic resistance? What are some clear steps?
Yeah, I mean, my number one thing with this is always going to be education about the problem of antibiotic resistance. And I mean, that's step one. And I know that's kind of a very vague statement, but for me, I mean, this is what I'm trying to do with respect to reaching out and doing different types of presentations and different types of what I would call kind of microbiology 101. I'm trying to use any resource I can so that I can empower other people that don't have any background in the world of microbiology, but that they start understanding kind of the basic things around not asking for antibiotics every time they feel bad, to really kind of educate themselves and to give it, that kind of conversation with a physician, for instance, that it might not be something you need. In fact, it might make the problem worse. As you know, if you take certain antibiotics, you can actually initiate C. difficile infection. So there's bad outcomes for taking antibiotics. People that take Cipro, like our friend Mary that we talked about, I mean, if you do that long enough, you start breaking down muscle and tendon, and I mean, there's all sorts of implications for taking antibiotics when you shouldn't. One of the things that I love to talk about that is that, and I just beat this to death to the point that people know me for it, but I just think when you go in, whether it's a ER or your doctor, I'm really working with people, everybody that I teach and everybody that I work with in the community, to ask for a lab test or at least to bring up the conversation. Does this infection need to be confirmed? And moreover, does it need to be ran for an antibiotic susceptibility test so we actually get the right antibiotic? Because you can, as you know, antibiotics are prescribed empirically, and that's dangerous because you may be giving the wrong antibiotic. You may be giving a broad spectrum type of antibiotic instead of a narrow spectrum, so you're kind of using a shotgun instead of a rifle to take care of the problem, and that leads to more resistance. So that's kind of a roundabout way, and it's kind of a vague answer, I guess, but for me it's always going to be education, and then as you learn about this problem, to share that with your friends and family, and to try to build a culture that starts curbing this problem. Unfortunately, I think what happens most of the time is that people, with a lot of things in this situation around public health issues, is they really don't act until it becomes personal. And so, I mean, I can tell you the people I know that I've worked with that have had this issue in their family, for instance, they have had a life-changing moment, because it's become a necessity for them. And I'm hoping we can move more proactively on that and start the conversation, even as low as, secondary education, down lower where we start talking about this in our educational pathways and other mechanisms.
All right. Well, as I mentioned in the intro, it is World Antibiotic Awareness Week. And Dr. Rohde, can you discuss the importance of this week? And is there anything specific that you're doing at Texas State to promote awareness?
Yeah, again, so this week, Antibiotic Awareness Week, there's multiple, and I would encourage you after the show, and maybe Robert can link to this, there's multiple opportunities on social media this week around different hashtags. One of them is hashtag Be Antibiotics Aware, and it's Antibiotics Awareness Week. There's just multiple hashtags that are going around with this, as well as some great resources that even I've been grabbing and saving, different types of kind of social media savvy images and different types of videos and so forth. So I've been really working with that this week here at Texas State. I've been working through my program, the Clinical Laboratory Science program here at Texas State, because most of our students, as you know, will be working in medical laboratories, so they have a definite interest in this type of thing. And then I've been pushing this out to the greater university community. I've been pushing it out to the city we're in, and I can't express my thanks enough for being able to talk with you on your show to kind of get even a larger audience for this. So I'm speaking, writing, and sometimes screaming about this problem to just about any and all that will listen. So I would encourage the listeners that, especially those in professions that touch this topic, and it really crosses everybody. I mean, whether you're a physical therapist, a nurse, a physician, an infectious disease pharmacist, I mean, all the way down to just about anybody in healthcare, to take some time this week to try to share this topic and this particular slant about trying to eliminate, if not reduce, this problem from anywhere from writing a letter to the editor, or maybe just going into a classroom and talking about it, or sharing that type of information so that we can spread that word. But then it has to keep going, right? So I mean, when this week ends, it's like any other week that's out there for awareness. We love that week, but really we need to push this on a very consistent basis. We need to be active at our political level. We need to be active in our communities and try to be good stewards. Just like we're trying to do in healthcare, we need the community to step in and do this consistently.
That's right, because it doesn't end when this week is over, that's for sure. All right, well, Dr. Rohde, we covered a wide variety of issues concerning antibiotic resistance. I'll give you the floor to close if there's anything else you'd like to add to this topic.
Robert, again, I'd like to thank you for the opportunity. I'd like to thank your listeners for checking into this, and I hope they follow up with some different exploration, maybe, of different things out there. I think I would like to end with something around how important this topic is with respect to the stewardship piece of this around the interprofessional effort, really across all continuums of care. It's certainly going to involve very timely and kind of optimal selection and dosing. I mean, this is where pharmacy gets involved and physicians. We need this interprofessional effort to be ongoing. And I think we all just need to take a step back sometime and kind of slow down and take a moment to listen to patients or families that are telling stories about this, because this is how it's impacted what I do. I love my career as a medical laboratory academician, and when I started hearing these types of stories from people with respect to MRSA research, it really changed my path as trying to become more of an advocate and a megaphone for these types of problems, because we all get very busy. We all get in our silos of healthcare and academia and anywhere else we're at, and we kind of approach a problem. We all tackle problems, but sometimes it really takes kind of a cross-cutting interprofessional perspective. It's really common sense, but it's sometimes hard to do in practice. And so I would just kind of like to end with challenging everyone, especially in the healthcare community and the veterinary community, to kind of try to come together in a One Health type of approach so that we can tackle this global problem.
Well, very good. I want to thank you, Dr. Rodney Rohde, for your time and expertise on this topic. I appreciate it very much.
Thank you, sir. Appreciate the efforts.